It is December 17th, 2020. I want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the data that's coming out of Arizona to help you better understand the situation we're experiencing here in Arizona so that you can make the best choices for yourself and your family. As I always say, you know their health and lifestyle better. We are just here to help guide you through these numbers. So we begin with some pretty big numbers, in fact, coming out of the state of Arizona. One thing I do want to note, a milestone that was just passed moments ago, and that is we hit 17 million cases here in the United States. So once again, 17 million cases here in the US. Brant saying, welcome back. Thank you, Brant. It's good to be back. I had a couple days off and back with you again. So thank you. And Kristen says she felt stood up yesterday. We apologize. The governor took over our time slot and we had some computer issues as well. So we're back with y'all today. All right, Garrett, let's get to it. Let's start where we always do on that data page.
All right, so today, 5,817 cases were added. That's still in the top 10. We're still adding cases in the sort of the high numbers. It's not a record by any sense, but still sort of a top 10. Now our death number we added today, 147. That is the third highest number of deaths that we have ever added. Expect, sadly, this number to go up. We should see a record death report here in the next week or two, but that's sort of where we are. The 7-day rolling average for our cases now is at its second highest. It is going down a little bit. Let's see, let me just get the case estimates for the deaths. 7-day rolling average for deaths is now at 74. Again, not at its highest numbers yet, but it's getting there because our highest 7-day rolling average for deaths was 82 on July 18th. So that's where we're getting close to sort of a peak number in deaths as well. And I'll show you some of the more concerning things about that. The 22,575 tests that were added today, that's actually a quite high number. However, let's just go through one of these really quick. We are starting to see a leveling off in our case numbers. And this is important to point out. As you can see, we have 2 weeks now, the November 30th week and the week of December 5th, where our case numbers are quite level, and we're already past the point where we're no longer really adding numbers to these cases. So as of right now, we are at a peak, and there's no sign, an indication that it is going to continue on an upward trajectory. At least if it does go on an upward trajectory, it's not going to go at the same rate that it has been for the past several weeks. We look like definitely at this point, case numbers are starting to slow down essentially.
So there's sort of 3 peaks that we need to make note of or track as we go through this. The first being just the sheer volume of case numbers in itself, then a peak in hospitalization, and then sadly also a peak in death that you kind of just touched on there. So it is possible that this is sort of leveling out for our cases, but then we still have 2 other
correct,
maybe sadder and more dangerous humps to get over here.
Yeah, so the cases, of course, this is, you know, I know people have a lot of opinions on the cases and the reporting of cases. Some people say that we're over-reporting cases, the fact that we're reporting this every single day. I understand at least the argument there. However, there is the real fact of the matter is that no matter what this number is as far as asymptomatic versus symptomatic, a rise in case numbers will always portend a rise in hospitalizations, which will then rise the ICU numbers, which will then rise the deaths. So regardless of how many of these cases are quote unquote moderate or mild cases, it doesn't matter. Any sort of rise in these case numbers will correspond and cascade down to these other metrics that do cause, you know, like unfortunately sadder events like hospitalizations and deaths.
Yeah, and there's, I mean, no denying we're approaching 310,000 deaths here in the United States from this. So, you know, we're thinking of all those families who have lost someone as well. And here in Arizona, 7,677 are how many families are going to be celebrating the holidays without that loved one. So that's the concerning part in all this. And when you're reporting those death numbers and you're saying higher numbers are going to come in the next week is Christmas. You know, it's twofold. Getting awful news like that, although losing a loved one is obviously difficult any time of year, but especially during the holiday season to get that news. And then, also for everybody who might be getting together on Christmas and how that could then, kind of give these numbers, sort of caffeinate these numbers, if you will, and cause them to go up again.
Right.
It's concerning.
So I'm just going to go through my sort of normal report here. I've condensed it a little bit so it's a little easier for us to use. These are the reported numbers. These are the AZDHS reported. So this isn't date of occurrence. This is date of report. You can see this is what I'm talking about with this case number. The average, the yellow line has gone down. Our testing average is at a peak and continues to climb. Our death reports are now, as I said, reaching our peak number. And here's our percent positive, which is also level at about 18% right now. When we look at the epi curve information, this is the actual date of collection. We can see, this is what I'm talking about. You can see that the peak numbers now, the peak weeks, we're no longer adding a tremendous amount of cases to these weeks. We're now past that point. And that's why it does appear that we are in a leveling off period for our cases. Of course, we don't know what's going to happen in the next couple of days, but this is where we are at this very moment. As we can see, we go down to the tests. We can see the tests are at peak numbers. We just had recent peak days for testing in the last 3 or 4 days. And then I just want to, the death curve is very particular today. This is somewhat of a concern. As you can see, we've had, this light blue is what was added today. And you can see almost in all cases, this light blue was added only in the last 13 or 14 days. So there was a lot of COVID-19 deaths that occurred in the last couple of days. And it is impacting, in fact, it's impacting past the arbitrarily set 7-day rolling average deadline that I put on this, because deaths are a little less predictable. You can't really automate that line as much. So I have this, it's not automated in this one, and it's already passing that. And you can see it's being added everywhere. We're very likely looking at a point where we might be getting close to these peaks later. It's going to take, we won't see that until January if it does happen, but again, there is a possibility that it's going to happen. I just wanted to point that out.
Yeah, and it's not unlike what we're seeing all across the country. I mean, yesterday across the United States, it was the highest daily death toll number since the pandemic began. Depending on how you count those 24 hours, we had anywhere between 3,400 and 3,656 was the total number that they counted in for deaths just in the last 24 hours in the U.S. So these are beyond 9/11 numbers. These are daily highs for the modern history of the U.S. as well, not just for coronavirus.
I saw a couple people in the comments are looking for recovery numbers.
Yeah, and we can sort of address that with active cases. That's Marjorie was asking about that. Of course, we want to highlight the positive, and there are some silver linings. Man, we're chasing for them, because it's hard reporting on this stuff every day. Just as we know, it's hard for all of you to hear it. It's basically tracked by active numbers. And Garrett, I'll let you take away for the 435,000 cases that you start with and how you deduct out of those to get an active.
There is, Marjorie, there is no way to report an actual recovery number, because there is no set definition of recovery. If there was a recovery definition, it would have to be brought down by the Arizona Department of Health Services that we could use, and we don't have that. So what we do is we can report on what would be considered an active infectious case. So this would be basically cases that are within a either 14 or 27-day window, in which the probability that that case is still current and infectious is higher than obviously someone who was infected with COVID-19 3 or 4 weeks ago, 3 or 4 months ago. Obviously, the vast majority of people 3 or 4 months ago have recovered, but we don't know what a recovery looks like, so we can't publish that. We don't know, people who have underlying other effects, any sort of side effects. We just don't know. So,
yeah. So for some people, it would be a negative test, and for other people, they might get a negative test and they still, pardon my French, feel like crap. They might be back, at work from home or work or whatever. They've tested out of it, but they just don't feel the same as they did before. So that's why it's so hard to define that.
So our numbers right now we have about 66,000 cases in Arizona that are under 14 days old. So these are very likely, the majority of these cases are going to be infectious. So and this is confirmed cases, 66,000 confirmed infectious cases. 136,000 cases are under 27 days. And a good portion of these could be infectious, but there's no guarantee. That's sort of the high end estimate saying, and this is what I'm using with other health departments gave us this data as well, or at least not this data, this definition. So they say, if the case is over 27 days old and the outcome was not death, then we can consider that case inactive at this point. And that's what this number is, that 136,000, anything about that. So that's about the low and exit. So basically 300,000 cases in Arizona that we talk about all the time, 300,000 cases are likely inactive in Arizona, no matter what.
So that helps to better understand how things look for activity of this. And like we said, if there ends up being a definition for recovery that we can all go with, that everybody sort of agrees with, then that's the one we'll use. But at this point, it's sort of, how some people are feeling great, some people are not. Some people are rewriting their wills, some people have the sniffles. It's different for everybody. So thank you for that question, and we'll get to more of those. I know everybody's asking about the zip codes. We are going to get to that. We're going to get to schools. A few more minutes, though. I want to highlight some of these very pressing numbers, not only on the summary page, but with hospitals as well, Garrett.
Yeah, let's go over to the hospital page. We do have some numbers we have to talk about there. Because as we talk about, that's in my, it's not even in my opinion. Realistically, the hospital numbers are the most important numbers. So here we go with hospital bed usage and availability. This is self-reported by the hospital systems. You can see our available headroom is 92%. 92% of hospital beds are taken up right now in Arizona. And that is, I believe, a record. I'm checking right now to see if that is a record. And I do believe it is. It is. 92% is a record. So we have, at least for the reporting period, the most amount of hospitalizations or ICU beds that we have. The inpatients, the same thing. We already record today too. 93% of inpatient hospitalization, inpatient beds are taken up in Arizona right now. Emergency room going up, but still plenty of beds in the emergency rooms. But you would expect that because obviously with the emergency room, the beds are more of a holding place. And then we go to the COVID-19 specific metrics. We are at another record for inpatient today, the most number of COVID-19 patients hospitalized. We are getting close to our records in ventilator usage for COVID-19 patients. Our ICU beds, again, getting close to records, but not quite there. We're still about a few days off of our record numbers from the summer. The discharges are still as high as they've ever been. And then the emergency room department, you can see we were talking about this big spike and big drop we saw. We did see an increase today, and it looks like it's going to average out over time to a somewhat of a small increase on the slope as far as what it looks like in the emergency room visits. And then intubations, again, we're still sort of trending in an upward direction with intubations.
So tracking all of these numbers, this is specific to the state of Arizona, not down to county by county. And obviously there are different situations happening in Pima County versus Maricopa County and other places. So again, this is an overall statewide number. Somebody was asking or saying, who's rewriting their will? To be specific, Larry Fitzgerald. So an American football player here in Arizona, for those of you who are not watching from Arizona or are unfamiliar with him, but if somebody in the National Football League who gets this gets freaked out enough or sick enough to rewrite their will, it can affect any of us. So that's the answer to that question. And just at 37 years old too. So, all right, Garrett, I want to get to some of these zip codes and help everybody understand these numbers that are coming in, and specifically the CLI, because that number is a county-wide number that's being put out to help schools make decisions about staying open or going back to hybrid learning. We're approaching, for most schools, they're going to be out of class starting tomorrow. So tomorrow will be the last day. So it's interesting to see some of these schools that are making changes when they only have 24 hours left, or saying, stay at home tomorrow and then we'll regroup next month. Many coming back to class January 4th, and you can find a detailed list of how schools look and their response to it, these choices that they're making, on abc15.com/schools, a complete list there of closures and changes. Our education team staying on top of all of them. So many, too many, in fact, to go through on here, but that's where you can find your school, your child or grandchild school, or just the school that's there in your neighborhood. All right, so Garrett, how do things look today?
So the CLI data, I've got it in two different places. I will have it, I've got the Maricopa County one as well, but our CLI data for the week of November 29th, which is the most accurate, you can see it's at 16.4 for inpatient and about 11.9 for emergency room departments. You can see some these drops that are happening, but the CLI always drops for that particular week, the most recent week that it gives data. So it's not really a trustworthy source for that most recent week. You really have to go back to. But you can see a slowing in the inpatient trend. It had been going up. Now this number could change as estimates are reevaluated. However, it looks like it's slowing on the inpatient. It doesn't look like that the case on the emergency room. It's still, I mean, like I said, just ignore this downslope. It's still going at the same direction. If we look at the Maricopa County CLI, and this is the one that is used to power the schools dashboard. So this number will reflect everything. You can see our most recent number, 16.5 for inpatient, 10.9 total. That's the one that you'll see on the dashboard. And then 8.8 for emergency is the most recent data we have. Okay. That is good. They do have this one is sort of within the gray. So I would say let's just be careful with that one. Let's stick to the one on December 5th. Yeah. Is the better data feed for them.
Yeah, the data is solidified then. Okay, so, and I'm seeing somebody in the comments say that you guys spent a lot of time on that on Monday, which is great, and saying that it was really helpful for understanding a little bit more about that CLI. If you're ready, Garrett, we can dive into that zip code map today.
Well, let's go to the RT first.
Oh, yes.
We'll spend a lot of time with the
yeah. I was curious about the RT because while I was away from you guys, taking a few days off, helping my kids with all their schoolwork, and thanks for your concern. People were saying, did she test positive? No, I just took a couple days off. We're here at home studying away, trying to finish.
There were definitely comments in the
I appreciate everybody's concern. We had Friday off to get the cram session done for all the schoolwork turned in, and then I had a couple more days, so I just took Monday, Tuesday as well. So we were working away, and safe here at home, which is the good news. Okay, so I did notice while I was away, it seemed like Arizona was the last, like we were the worst in the nation, which is sad and embarrassing. You hate to be the problem child, if you will, of all the other states, but we haven't climbed that much better. I see us in third from last right now.
Yeah, we're here with California. We're at 1.15. California's at 1.16, and Maine's at 1.23. But as you said, even though this is calculated on a regular basis, this is recalculated. At the time when we were doing this, we were at 1.22 for several days, and that's why we were at the top. But we're here. Yeah. We're still at basically this driving this third to last type area. And who knows what's really going to happen here. It really depends on what's going to happen with this leveling off. If this leveling off does continue, then we will drop pretty quickly closer to this one. And we'll see that probably Monday or Tuesday of next week. Again, if the leveling happens and it continues on, then we will see our RT drop pretty quickly.
So this is more tracking a change rather than tracking the day-to-day or overall numbers.
Yes, correct.
So that's where you can find that. We always highlight RT.live just because it's such an easy to read site. You see the error bars that extend to the top and the bottom, which shows our range of possible number within that, but it gives us that specific number where they're more confident our number lies. So 1.15 for today. All right. Got that covered. I do want to update some information that is just coming out, long awaited, breaking news coming in that you may have just gotten the alert on your phone that the FDA's Vaccine and Related Biological Products Advisory Committee panel has endorsed Moderna. So we were expecting that the Moderna vaccine would be reviewed today. They've been in session, and then they have come through and said that they do endorse that Moderna vaccine. Obviously, the FDA then still needs to officially authorize it for emergency use. But as you saw with Pfizer, I mean, that was like amazing logistical nightmare that they've overcome. And so many of those folks who were putting that together were doing that from home. So they're working from home and they're organizing the trucks and the freezers and all of the things to be able to get those first vaccinations out there. So having another option for vaccination is huge. And Garrett, I believe, I don't know the exact dates. It's a little bit of a shorter time frame between shot 1 and shot 2. So one was like 26 days and then.
Yeah, I think it's like 23 or 24.
Yeah.
Yeah.
Yeah, so it's just a little bit shorter. And I saw this question a lot. I know you guys did the panel while I was gone to the town hall, if you will. A lot of people were asking, can you get a different version of the shot? So could you get like Pfizer the first time, Moderna the second time? And that is not the case. Yeah, we just want to stress that you're going to be asked to go, with the same brand, if you will, the same one that you got before, which also aligns with how specific that was for the date of the shot. All right, so that developing news, that breaking news just coming in, if you have those alerts set up on your phone, that did just come out to you there. We'll have complete reporting on it coming up for you in our afternoon and evening newscast. Becca's writing, I'm so over this. Becca, we all are. Man, this has been quite a year, isn't it? It has been a lot to get through, and if you haven't lost someone to this, or you don't have someone currently or in the past year in the hospital with this, I guess I would say count yourselves lucky, because this is such a devastating thing for anybody to experience, but then especially those who have experienced this disproportionately with the loss of a loved one. That's something that can never be brought back. So we're thinking of those families. All right, everybody's typing in their zip codes.
Brant, since Brant is a regular watcher, he wanted Iowa's RT. It was 0.94, Brant.
Oh, you're so good to help him out. Brant,
okay.
Happy to help.
First we're going to start at my maps before we move on to Maricopa's maps. And I'm going to start with the unified school districts and the elementary school districts. So this is where we are right now. The highest district is at over 1,000 for the week, 1,000 per capita. And that is Roosevelt right here at about, hold on a second, let me get to it. You can see Wilson Elementary School, I'm sorry, not Roosevelt, Wilson Elementary School is at 1,000. You can see when you look at the East Valley, there's still very high numbers in the East Valley, over 600 in most cases. It gets a little better as you get into the sort of the near East Valley, with Kyrene being 476. The farther north you go, the less it gets. But aside from that, pretty much we're in the 700s almost everywhere. There's very few places in the county where the per capita rate is not under 400. I think Fountain Hills is one of them at a 261, Cave Creek at a 333, and then Morristown Elementary School, which who knows how many people live there. That's at a 249. So, and then these are very rural districts out here. Not a lot of people out here in these areas, but really these are the most concentrated areas. I'm going to, like I said, I'll start with this one, but let me then put up my zip codes. I just have to redo it here.
That's fine. And as you do that, a lot of people just saw Katie Smith's comment, and we appreciate it. Garrett's maps are so much easier to read. Thank you. So she appreciates the extra time that it takes for you to put those together and get those to us to help us better understand. It really highlights, I think Katie might agree, it really highlights that southeast area of the valley and shows how much that spread is really concentrated right there. I mean, we're seeing it everywhere, the pockets like Roosevelt and other places, but it really helps you kind of split the valley into quadrants and understand the storyline is different between zip codes and school districts.
Yes, absolutely. I'm looking, trying to see what I got here. Let's see if this is correct. I have two maps. I'm trying to, sorry about that.
That's okay.
I'm my two maps, like, why did they come out slightly different?
As you're looking at that, Garrett, it's okay. As you're running that and figuring out what's going on with that, I always update the top 5 states overnight that have sort of reported numbers in, just so you can track it, especially through these holidays for people who are still making the decision to travel. That being California in the top spot, Texas, Florida, Tennessee, and Pennsylvania. So those 5 states taking the top spot: California, Texas, Florida, Tennessee, and Pennsylvania, the top spots with the most cases reported in overnight and the most concerning jump in cases as well.
Okay, I'm ready for you.
All better.
here is our zip code map. You can see our top again is still in that 1,000 area. Or 900. It's in the 900. 919.45 is the top one at this point. And here we are at this week, 604 again. It looks like still a lot of activity in the East Valley. And then we've got some other in the northern area as well. But really, we're still seeing like some heaviness in the East Valley and the sort of southwestern valley as well. is where a lot of the zip codes. You can see a lot less. You know, I don't want to say a lot less. Again, we're still over 300 or 400 in almost every case in a urban zip code at this point. So you know, when this is all subjective when I say that, but you know, when you're talking about zip, you know, comparing them, you know, one to another, if you will. The Sun City area, you can see actually lower numbers in the Sun City area, 277, 356. So this is a way to visualize the regions. So just so you can kind of see what these look like. So
Yeah, it
what I'm
helps.
going to do now, of course, is go to the map, the one that we can actually go to and search. Yeah, so let me do that really quick. And here we go. We will start with the cities. Just to give an overview, there are no cities in Maricopa County that are under substantial transmission. And so we're not going to spend too much time on that. The unified school districts, exactly same. No unified school district is in moderate any longer. The high school districts, there are no high school districts that are in moderate. And there are no elementary school, oh, excuse me, there are a couple elementary school districts in moderate, and they're very, very low population districts in the southern portion of the county. But again, when we look at the zip codes, we see sort of the same thing. See that really the zip codes that are considered moderate at this point are zip codes with very few people in them. You can see no cases simply because there is almost no one who lives here in 85190. Same situation here in Gila Bend. There are people who live in Gila Bend, obviously, but it's a very low population. The percent positivity is at 7.4, and their case per 100 last week was at 89. That's what's keeping them yellow. And 85333 Dateland, you can see very few people live here. But really, for our purposes, you know, here is the Maricopa County, the population part of Maricopa County, and it's all red. You know, and again, this map doesn't differentiate like mine does with the gradients. So we have to go zip code by zip code to see what is the difference here. So like we'll go with 85255. We'll start there. This one grew from 335 to 428 this last week. 85209. 85209 went from 376 to 503. So it's over 500 at this point with a 15% positivity rate.
Wow.
85304. 85304, 278 to 550 as well, with a 21% positivity rate. 85345, this is a Peoria zip code, 570 cases per 100 from 350 to 570 at an 18% positivity rate. 85033, 726 with a 25% positivity rate. So basically, 1 in 4 people that went and got tested this last week positive in this particular zip code, 85033. That's nearly double what it was last week. So 85301. 85301 Glendale, 525 with a 25% positivity. 1 in 4 people again testing positive in that zip code. 85008. This is a 626 with a 20% positivity. That is an increase from the 400 they had last week. 85306. 85306 Thunderbird School. So this is a, yeah, so let's see, this is 320 to 491 with a 20% positivity rate for that zip code. 85041. 85041, this is a 651 with a 21% positivity rate. 5173. Sorry about that, I don't have that zip code. 85365. I don't have that one either, sorry. 85051. This is 352 to a 507 with a 21% positivity rate. 85212. This is down in the East Valley. This has gone from a 542 to a 687 with an 18% positivity rate, slightly lower positivity rate than some of the other places we're looking at. Again, East Valley Mesa, 751 from a 47 to a 751 with an 18% positivity rate. So that has grown, of course. 85027 Deer Valley, 344 to 383. Very little growth in that particular zip code. 5306. 85306. I already looked at this one. This is 320 to 491. 85301. We've already looked at 85301 as well. 85205. 85205, 427 to 571 with a 16% positivity rate. So slight growth in that district, or zip code, sorry. Sun City West. Sun City West went from a 178 to a 356 with a 20%.
Wow.
So 1 in 5 people. And of course, we have to, point out that because of the demographics of this particular zip code, you don't want a lot of positive tests in this particular zip code.
Yeah, it's especially concerning for this age group.
Yes. This is Dobson Chandler, and this is 446 to a 626 at 16%, and that's 85224, 85339. This is Levine from a 439 to a 694 with a 20% positivity rate, 85383. This is 360 to a 607, so almost double, from 12 to 17% positivity, 85258. This is McCormick Ranch from a 273 to 335 with a 13% positivity rate, 85259. 85259 is, again, Shea Corridor, 319 to 319, so no growth in the Shea Corridor with a 14% positivity rate in that area. 85033. I think I've already done this one. 461 to a 726 with a 25% positivity rate, so 1 in 4 people.
Yeah, Jennifer's saying, wow, the spread is crazy.
Yeah.
It really is.
Yeah, 411 to a 530 with a 14% in 85257 right now. 85016. 8516, the Biltmore Corridor, 309 to 440 with a 20% positivity rate, so 1 in 5 tests. 85251, if I can actually write this down. 85251 from a 418 to a 486, so little growth in that area. Still high, of course, but little growth. I will not have an 864. I'm so sorry. This is only Maricopa County. 85297. 447 to 597 with a 17% positivity rate. 85262. We'll do a couple more. 85262. Up here in Carefree, Cave Creek, it looks like 306 to a 284. So this is actually one of the rare zip codes that actually went down in their per capita numbers. 85142. Queen Creek, 412 to a 604 with a 30% positivity rate.
Wow. You said Queen Creek? Is that what that what I'm saying? Okay.
Yeah, 30% positivity rate in Queen Creek. That's pretty tremendous. 85027. 85027. Oh, I've already done this one, but this one's 344 to 383, just a slight increase. And one more, it's going to be 85017. 85017, Grand Canyon University. This is 329 to a 528 with a 26% positivity rate, so essentially 1 in 4. So yeah, this is, again, you can find this at maricopa.gov/school dashboard. As you can see, most of these are going up. We have very few situations in which the zip codes are going down at this point.
Yeah, and I think Ray is saying what we're all kind of thinking. Looks like the majority of us are going to get the virus before we even have the chance to get the vaccine. And that's, what a real concern is, why the rush to get these vaccines out, why you've seen those pictures of the trucks that were ready to roll, just waiting for approval, that they wanted to have everything in line to keep these vaccinations headed out as soon as they possibly could and really get them going. We shared some live pictures yesterday during our newscast of some of our frontline workers here getting the vaccine to try to, show that they're willing to get it too. Part of this is a PR nightmare, overcoming that as well for people who are not feeling exactly comfortable just yet in this. So one other thing on the vaccines, Pfizer, we mentioned, if you were just joining us and might have missed it, Moderna has gotten the approval of that early panel. So now it goes to the waiting for the full approval of the FDA for the emergency use authorization to have a second vaccine out there on the streets for us to use. A lot of stuff about the Pfizer overfill. So the vials have been overfilled in some cases, and they're saying, can that still be used? And they're coming out today saying that indeed can be allowed to be used. It's perfectly safe. It was an overfill issue. So if they were thinking they had 5 shots out of 1 and they actually have 7, that they are cleared to use those other 2. Questions coming up a lot, and I want to make sure we get to it. It's basically about schools and what is the plan for January. So although we can't go through every single school that is out there, and a lot of them are making changes right now, Garrett, we can provide some projections that are coming. And I want to go to the ones that you trust the most right now, that you think are pulling the most up-to-date data to give us projections into January. Now, January 4th is the key target date for many schools to return. Others that aren't returning that early are happening the Monday after that. So how do things look here in Arizona?
I'm going to rely on the University of Washington model again until I get some more of the other ducks in a row. My favorite model, the MIT model, is back online, but I have to get all the links set up and everything.
Yeah.
And just do a little bit more work with understanding his
Yeah,
new
because
model before I do anything else.
that's okay. I guess the concerning thing in all this, people are saying or hearing some of the modeling coming out of ASU, and they're saying, look, we're not going to be out of this until late January or early February, and you families are trying to plan, and they're taking these 2 weeks off for the holiday season and really trying to figure out how they're going to do this for the following semester, because we're seeing some schools that haven't closed in a long time now saying, like, we're not even coming back in January. So how does that projection kind of look?
So what we have right now with our projection is the estimated infections in Arizona, pardon me, from the University of Washington. Oh, sorry, I've got the hiccups. From the University of Washington are considering right now that we are at a peak and should begin a leveling off of our cases at this point. This is where we are today. It does believe will be slightly higher. It looks like, ironically or not, whatever, December 24th, 25th is going to be our actual peak. And then it's going to start continuing down from there until it gets to about March 30th. That's as far as it goes out at this point. And I have right here rapid rollout of vaccine and projection to show you how it diverges. It doesn't diverge until the end of January, and it takes until really the middle of March for these numbers to really start to be different from one another. And that's sort of what we see right now. When we look at the daily deaths numbers, we see the same thing. We talked about how cases portend deaths. We're at a peak now, but obviously our peak for deaths isn't supposed to come until early January, where we then will start, after a vaccine rollout, then the vaccine numbers will start to kick in and we'll start to see less daily deaths as well. And we see that everywhere in all of these, where the vaccine only kicks in sometime in late March, February, as far as what the numbers look like.
Mm-hmm. It sort of seems, and I don't know if it's a misreading of data or a delayed reading of data, when the community sometimes starts to react after the high peak. So it's like that got too much for them, and then they're making changes, either shutting down schools or maybe we're seeing the mobility numbers pull down. It's kind of like that information sometimes in some of these arenas can be slow to get out, and we're seeing the reaction delayed as well.
Yeah, we do have, if we look at the mobility data, and we just take a real quick look at that, I'm re-rendering it up, we can see it actually is pointing down a little bit. There are some peaks and valleys, of course, as you would expect with any sort of data set, but the actual trend lines are starting to sort of go back down at this point. And as soon as it renders, I will show you what I'm talking about.
And you're saying we can't compare like past years to this particular data set, because this is one that really only started post coronavirus?
Correct. See, the thing with an index, and everybody put out indexes this year for mobility data, you need a baseline for an index to mean anything. And so even if they put out mobility data last year, which I don't even know if they have, I'm sure that they have it. I mean, these are massive cell phone companies. They have this mobility data, but they're not releasing it anonymized. So this might be something that they'll check, and they'll some academic some university is going to do a study on this over time on what the mobility may have looked like in 2019 as opposed to 2020. But when we look at the data now, and I'll share the screen, this is the mobility data that has been anonymized. You can see, and this is throughout the entire thing. This is our baseline up here, and this is where everything sort of started. And where you can see we've had this gradual climb up. And this is actually Thanksgiving, where the mobility just went down to just cratered. And then it went back up again, but it's going back down. So right now, our trend line is sort of on the direction of about 50% mobility. And again, this might be a holiday thing. We don't know yet. We'll have to watch this as it goes along and see what happens. But it does seem that our mobility is being impacted and that it is going down.
Yeah, it's just fascinating. It will be interesting when we do see past years to see how the holidays do affect mobility. Just interesting. Garrett, thank you. All right, we just have a matter of seconds left. I want to get your opinion on what you're going to be tracking closest or closely tomorrow, being a Friday heading into the weekend. Of course, the concern over our hospitalization numbers and the concern of people not being able to get treatment for things other than COVID. Now we're starting to get some emails into the newsroom about concerns over that. And, somebody with a foot issue emailing in and saying, I've been sitting here waiting for a transfer, but it just sort of illustrates how crazy things are in our hospitals overall. Is that something you're watching closely, or what's highest on your radar right now?
Watching, the hospital. We need to watch. Someone made a mention about Embry Women's Health, and we are going to be watching the testing data going forward in the next couple of days because Embry Women's Health had some issues with their capacity and their testing, and they actually had to send out something saying, hey, if you got a test before this date, you have to get retested because we don't have it anymore, whatever their answer was. So because of that, we are going to be watching the testing data to see if any sort of lag develops in the testing data and if that impacts the case numbers we're seeing. We're talking about a leveling off right now, but if Embry Women's Health is a significant number of these tests and they are basically slowing of capacity, we may not be in a leveling off. We just might be in a reporting lag that will start to show up. So we have to watch that. And of course, as you said, hospitalizations, super important what's going on with hospitalizations. They're reaching peak numbers right now. And really, and some people who are, of course, detractors about this whole thing will say, well, it's flu season, and they always reach, capacity at flu season. While that might be the case for a day or two in flu season, it's not sustained. So we have to continue watching to see where these are and to see how far they get. Right now, like I said, we're hitting records on a daily basis, not just with COVID-19 patients, but also with the entire hospital census.
Yeah. Okay. All good things to watch. And we will, of course, take a closer look at those when we join you at the same time, same place tomorrow. I'll be back. In fact, I'm going to the station now, rushing over there now to do the 5 o'clock newscast. So I'll drive safely and slowly, but I will be over there for that. So our newscast coming up in a matter of minutes, our 4 p.m. newscast, 5, which I'll join them for 6 and 9 and 10 p.m. Miss Ray, I don't want to pronounce your first name wrong. Danya, I hope I'm saying it right. She's asking if there's a way to rewatch this program. Always, and we love that question. Happy to answer it for you. Once we sign off here, it'll repost onto Facebook in its entirety, or you can find it on my Facebook page, which is facebook.com/news from Katie. And then I'm going to tell you also that you can find it on all of our streaming devices, which is like Roku, Apple TV, all of those, and also on YouTube. I knew I was forgetting one, on ABC 15's YouTube channel. So many places to find this. You're welcome. Hope I said your name right. Many places to find this, and we're so glad that you're joining us for this and getting updated. Yeah, Katie's saying, or on YouTube. So all those places, and you can also get updates outside of the video updates that we do here on our Twitter accounts. Garrett is @_Archer. Although you were having some computer stress, I'll just put it that way, or backcoding stress. I don't want to use the wrong term.
We got through it today, so I finally we got it all taken care of. That new testing dashboard kind of messed me up on everything that I do, and it took about 24 hours or so to fix my issues, but we got them fixed. We're good.
I wish it only took me 24 hours to fix my issues. That's for another podcast, right? All right. Send us your questions on Twitter or Facebook if you have them. We'll try to get to some of them tomorrow, but we'll be back same time, same place. All of our newscasts, as I mentioned, you can find them at their specific times, but if you miss them, all of our coronavirus reporting can be found at abc15.com/coronavirus. It's all right there. And one more place, since we talked about the schools, and I know so many of you are getting emails from your school district right now telling you about changes and so many to keep up with. You can find that at abc15.com/schools. So that information listed right there as well. In the meantime, be safe out there, and we'll see you tomorrow, same time, same place.